forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello everyone, I'm very honored to be with you again from this studio, COVID studio, to introduce another international educational course provided in Tabriz University of Medical Sciences, Imam Reza Hospital. When we are recording this video, it is a rainy summer day in Tabriz, and I'm very pleased to host Dr. Mansour Ghafourifard here. Thank you, Dr. Ghafourifard, for accepting our invitation. I would like to ask you to introduce yourself and your field of activity.
In the name of God, the compassionate and merciful, I thank you for invitation for this session. I am Dr. Mansour Ghafourifard. My interest is the nephrology nursing, and I am an associate professor in the Tabriz University of Nursing. And I'm working in the hemodialysis center of Imam Reza, affiliated to Tabriz University and of Medical Sciences, located in the Tabriz. This dialysis center is the largest dialysis center in our country, Iran. Thanks a lot.
Yes, great. Very good. You talked about your background, and I think it shows that the course you are going to provide is somehow related to your field. Would you please mention what is the title of the course you are going to introduce, and we will talk a little bit in detail about the course then.
Yes. The title of our courses is about the nursing care for renal replacement therapies. As you know, chronic kidney disease or CKD is one of the main chronic disease which is growing in the worldwide, and it's expected to rise in the future decades. So in these courses, we are going to provide sufficient knowledge for the audiences and learners who want to work in the field of hemodialysis or peritoneal dialysis and in the field of kidney transplantation. This course will be held in long and short periods. In the short periods, we can provide this course in a 1 month period, and the long term could be done in the about 3 months periods.
Very good. So you have two different versions based on the needs of your participants, 1 month or 3 months. Very good. Would you please talk about some content, the details of the course, what you expect the learner to be involved with?
Okay. These courses, as I told, these courses has 3 sections. The learners could be participate in one section, or they can contribute in all 3 sections. I invited the audience to participate in three parts because healthcare provider or nurses who are going to work in this field, he or she should be informed about all possible options for the renal replacement therapy. In the field of hemodialysis, the learner could be able to learn about the fundamentals of hemodialysis, about the indication and contraindication of hemodialysis, and the nursing care for the vascular access. As you know, one of the main part of hemodialysis is vascular access, which we could access to the patient's blood and connect the hemodialysis motion to the patient's blood. So the learners could be able to provide the necessary nursing care for the vascular access, such as central venous catheter or CVC, and arteriovenous fistula or AVF, and arteriovenous graft or AVG. Moreover, the students could be able to adjust the patient's data in the hemodialysis motion. They can adjust the patient's data in the motion, such as patient blood flow rate and dialysate flow rate. Also, they can adjust the anticoagulations and other necessary procedures. Also, in these courses, the patient will be able to provide the necessary education for patients and their family about the dietary recommendations and about the fluid restrictions and about the treatment adherence. As you know, in this chronic disease, treatment adherence is very important, and patients and their family should be informed about the recommendations on the field of diet and fluid and drugs. Also, we are going to provide necessary knowledge about the shared decision making, because when a patient have an end-stage kidney disease, he or she could select one of the dialysis, one of the renal replacement therapy, and we should collaborate with patients and their family in medical teams for selection of the one of the best suitable option for patients according to the patient preferences, according to the medical evidences and best evidences. In the field of peritoneal dialysis, we are going to teach the learners about the procedure of peritoneal dialysis, the indication and contraindication of peritoneal dialysis, and also the learner will be able to informed about the types of peritoneal dialysis, such as CAPD or continuous ambulatory peritoneal dialysis, or APD, automated peritoneal dialysis, which is done by cycler or peritoneal dialysis motion. Also, the learners could be learn about the procedure of peritoneal dialysis and care for the complications such as peritonitis. Also, the learner, after completion of this course, could be informed about the necessary education for patients and their family on doing this procedure in their home. As you know, the peritoneal dialysis is done mainly in the patient's home, and we should inform the patient and their family to do this procedure independently in their home. And in the field of kidney transplantation, we...
So sorry, interrupting you. As far as I understood, the 3 parts of the course in a 3-month course contains hemodialysis, peritoneal dialysis, and transplantation. You talked about 2 different first and second type, and you are going to explain the 3rd category, kidney transplant patients. Sorry, interrupting you. Yeah.
Yes, I think that this course will be held in 3 months, 1 month for hemodialysis, 1 month for peritoneal dialysis, and the last month is related to the kidney transplantation, and we will collaborate with one of the other colleague, Dr. Zahra Sheikhalipur, for conducting the course of kidney transplantation. And in this course, the learner could be able to show the indications of kidney transplantations and providing the sufficient care for patients in the stage of pre-operative and post-operative procedures, and they could be learned about the immunosuppressive drugs, and they provide patients about the rejection of the signs and symptoms of the kidney rejections, and this course could be done in 1 month period.
Very extensive course, very useful course in a growing population of patients and stage renal disease. Thank you for your wide explanation about the course. Who is eligible to participate in this course?
This course is designed for Master of Science in Nursing and for students in PhD courses, and all the students who passed the baccalaureate nursing could be participate in this course.
Very good. We talked about the duration, about the contents and aims of the course, about the target audience, and I think the information is quite good for decision of the participants. If you think that you need to add anything to what we talked about, I'm here to listen.
I think that this disease, CKD, is growing in our society and in the worldwide, and we should pay attention to the underlying disease such as hypertension and diabetes mellitus as a main causes of this disease, and we should provide education for our students, our society about the prevention of disease. But when the patient suffers from the loss of kidney function, we should guide the patient and his family for selecting of the best option according to the patient's situation and conditions.
Very good.
Thanks.
I'm so happy that you
were
here today for this conversation. For more information about this course and about other courses provided in this hospital, please contact with our expert team or visit our website, and you will find plenty of possible courses, short courses internationally provided in this hospital. And finally, thank you for watching.